A warm welcome once again to all our current yogis, all those who are doing so much good work to make a difference in people's lives. No matter what platform of CSR we work in, I think the impact is going a long way towards nation building. A recent survey showed that 77% of consumers want to buy products from those companies who are doing CSR, who are looking to make a difference in people's lives and to raise the quality of life. So once you start your CSR, you want to know what would you like to do. Most companies want to do something which is aligned to their business. It's also a part of the company strategy. When we started Max India Foundation at the end of 2007, we, of course, were in the businesses of Live Max, and having the pillars of support of Max Healthcare, decided to do healthcare as our focus area. However, at that point, not many corporates were doing healthcare, very few. It was mostly education or skills or other things. So today at the crossroads, we are trying to figure out, should we do healthcare? How much is it needed? Now, all of you know that the percentage of GDP that our country spends on health is abysmally low, much less than many countries, even in our neighborhood. 1.5% is much lower than what is needed. And therefore, there is a requirement for us who have the potential to do something, to come into the fray. Now, the thing is that whether we are just ticking the box or actually doing things, everything, skill development, education, everything is necessary. But friends, health is the basis of life. Right from the time a woman is pregnant, she needs awareness, she needs health. Then when the child is born, and how the child is going to shape up intellectually and physically depends on how we are going to look after him, are we going to immunize him or her, how we are going to take care, and so on and so forth, right up to the point where we can help them to do surgeries. Therefore, for today's discussion, let us presume that, or let us accept, I won't say presume, let us accept the fact that health is vital. All of us are working on it. However, is it easy to do? Do we have permission to do what we can? Can we do things which really matter, or are we just giving talks on washing hands and health and cleanliness because we don't have the capacity to do things which make a greater difference, or we don't have the capability in terms of the permissions, the confidence, or other things? So today's roundtable is about each one of us sharing what we do briefly and speaking very honestly about the challenges we face and what can we together do to solve all these. What can we do together to make healthcare space on the CSR platform a moving and driving force in the economy and development of our country? We have some very, very competent people. And we will also have, if he's not already there, Dr. Arun Gupta, who's president of the Delhi Medical Association. And he has also promised to take it up with the government at a certain point. So we will speak as we go along. However, one thing I want to just put on record is, no one likes to be interrupted in the middle of their talk or to be told, please hurry up. So let's just set a time for, please be cautious of the time. And I would suggest, please cut out the good mornings and welcomes and I am so-and-so, because I'll say your name. So don't say it. Just start on what you really have to share, and that will be wonderful. So we first have Miss Renika Grover, who's head sustainability and CSR, Apollo Tyres Limited. National CSR Network has invited her to sort of set the context for today. And I just want to say a few things about her, which I've just received. She has over 20 years of experience in the development sector and started as a volunteer first. She worked for a decade in the UK with one of the biggest children's charities, National Society for Prevention of Cruelty Against Children. She moved back to India in a sustainability role with Apollo Tyres in 2014. And now she heads the global sustainability function and works with her team to drive sustainability management framework. She's a member of multiple committees and the CII Gujarat chapter, FICCI Environment Committee, etc., and was also with the Advisory Council of Creative Dignity. So over to Renika. Thank you for joining and being with us today.
Greetings. Thank you, Ms. Singh, and thank you for setting the context. Health is absolutely a vital area. And I thought for setting the context, I would actually highlight what we're doing in terms of some of the anecdotes I could share in terms of what we are doing. Thank you, CSR, National CSR, for inviting Apollo to this forum as well. So before I thought I'd start, I mean, this is a roundtable, which is absolutely the need of the hour, given the fact that there's so much that's happening in the area. But I'm actually very conscious as well, because since we have such amazing, I'd request people to just put themselves on mute because I can't. Yeah, thank you. Apologies again, I can't hear. Thank you. So yeah, so I was just saying that I'm just conscious that there's such great, absolutely, very insightful people present in this panel. So I thought I'd just kind of highlight in terms of in the space of why we're doing this and what we need to do. So when we look at any project, and then you've actually set the context right, and you said it, that health is really important. We all need to do something in this space. But when we look at overall healthcare, or any other program, usually there are three fundamental questions that come to one's mind. And I don't have any specific presentation to share, but when we're anyways, any intervention, why do we need to do that? What do we need to do and how do we do? These are like basic fundamental questions. And just in terms of why do we need to do that, it's kind of a given with the frail healthcare system that we have at the moment. It's absolutely essential, but also with COVID, when pandemic happened, it exacerbated the situation further, which all of us have experienced. There was the healthcare needs of other emerging conditions. Actually, the services dropped extensively because the whole country was fighting for COVID. When we look at the budget allocation as well, I mean, all of us are aware, in terms of the government's allocation, when we look at the currently, it's about 1.3% of the overall GDP. There is a need, there is a vision by the government to say that they will move to 2.5% of the GDP. However, when we look at the FY23 budget allocation towards health, there is only 0.23% increase. Now, of course, the government is doing as much as possible. We've seen there is a lot of, we've managed to control COVID, not eliminate, but we've managed to control COVID, and there is a lot of expenditure that's incurred over there as well. But that's where we have the need that's defined. There is a healthcare need in the country to be addressed. There is a budget crunch. There is a requirement where the resources need to be pulled up. Pulled together. And that's one of the critical areas that why we need to do this program. Also, when we compare in terms of what our budget allocation is about, what our vision for India is 2.5% of the GDP, but the average spend in other countries, when we look at global spend, is about 6%. So we are still below. So that's where we need to pull as many resources from various, from various players in the ecosystem to come and address this challenge. In terms of what we can do, there are lots of areas, but I just thought Mohit had highlighted about the CSR spend. Of course, that is one of the critical areas. CSR spend is one of the spends that can be looked at, but just to let you know, until since the CSR law was established till about 2020, I have the figures, where about 90,000 crores have been spent under CSR. The three areas which absolutely have, where 38% or about 40% of the spend is in the three critical core areas is livelihood, education, and communities with special needs. Saying that, I mean, of course, it's a legitimate extent. This is absolutely a requirement as well. Healthcare is still below that. So there is a lot of there is still a lot of ask from the corporates to look at healthcare in terms of how the expenditure or how the CSR funds can be spent. And I'm not just saying that because we are working in that space. It's just that there is that need. It's not just because it's not just for the government to do this. It's also the corporates need to support it. But what can the corporates do? So we're just kind of reflecting back, where exactly can there be areas where what can be done? So one definite area is where we look at the infrastructure. The improvement in the healthcare space is really important. The reason I say that is, so we work in the truck driver segment, which is a disadvantaged community, and in terms of the accessibility. And one report mentioned that 50% of the drivers on the road experience healthcare problems because of accessibility. So the infrastructure development is absolutely key. And of course, we took this up as a program, and that's something the corporate players can look at as well, because the infrastructure is there, but the accessibility to the infrastructure might not be there. And in remote areas, in the Indian hinterland, there are hardly any places. So there was another very interesting report that said that accessibility is the cause, but quality is also the cause as well in terms of deaths. But the most important, where the highest rate of death rates is, because the amenable death rate in India is because of the accessibility issue. So that's where when we're looking at corporate players, we could look at potentially in terms of going forward. The other area when we look at is, of course, the frontline professionals. Now we have the infrastructure, but the professionals is again one of the other areas where we have frontline professionals, but we, according to WHO, we need about 1.8 million doctors, nurses, and more healthcare professionals to come to a minimum threshold level of 44 or 45 is to 10,000, 45 is to 10,000. So that's where we're gearing up to, because there is that dearth of medical professionals as well in the field. The third thing which I thought was very important, and that comes from the space that we're working in a lot, is the awareness. It's good to have the infrastructure, the professionals, but the awareness level of the communities or when you're in the Indian hinterland or where, amongst across the beneficiaries is really, really minimalistic. So we're looking at prophylactic measures in terms of how we can make sure that the awareness is generated where the health-seeking behavior increases. So that's one of the other challenges that we experience in India, and that's one of the critical areas as well, where we could actually contribute in terms of creating that awareness of how and what and of how people can access the infrastructure which is there, or actually utilize the services that are available as well. And that is one of the biggest challenges in India, and that's something I say because when we work extensively in tuberculosis now, people, it's because it's a taboo. The health-seeking behavior is really minimalistic, and we have to push our beneficiaries to even look at that as one of the causes. So that's the overall in terms of what as corporates we could look at. With regards how, I mean, you've already highlighted some of the points over here. Might just highlight very, very few things. When we talk about the sustainable development goals, and health is one of the areas in the SDGs as well, but one thing which it talks about is collaboration. You cannot you cannot achieve something by silo working. Collaboration with shared vision, shared goals is absolutely essential, and that's what SDG 17 was all about. With collaborative working, and that's what I'm really pleased that National CSR has got this roundtable organized, because that just helps people to look at where they have common interests, where they have common vision, so that they can collaborate and make it a more holistic approach rather than working in silos. So that's the only, sorry, you were saying something, Ms. Singh.
No, I was just saying that thank you for bringing this out.
Yeah.
And your points of challenges of infrastructure, I think, is a very, very valid one, which we should address with the government. There is a shortage, of course, and even of frontline professionals, which we may not be able to do much on CSR. Awareness definitely could be a CSR issue, definitely. Thank you very much. You were very articulate. I think you've covered all your points, or did I interrupt you?
No.
Yeah, thank you so much, Renika. That was very nice. Thank you. And take these up, and your point of collaboration, I think, is well taken. And I think that's the whole point of today and of getting all of you on the platform.
Thank you so much. Thank you.
I now call upon Dr. Neil Ratan Shende, who's GM CSR of All Cargo Logistics Limited. Please come and share your views on what the challenges you have faced during your CSR journey. Dr. Neil Ratan R. Shende from All Cargo Logistics Limited. Are you there? Okay, if he's not there, then we can move on and we can ask him to join later. And do we have Sanjay Datta, GM CSR, Endurance Technologies Limited? Sanjay Datta?
Yes, ma'am. Good morning. I'm here.
Good morning, Sanjay. And over to you. Please share with us your thoughts on the challenges you all face. GM CSR Endurance Technologies Limited. Over to you, Sanjay.
Ma'am, my humble request to you is that I have just joined the meeting because there was some other related issues. That is the reason I have just got into the meeting. So I'm just not through with the flow of the meeting. So I request that if I have been given chance, say after one or two speakers, that will be more fine.
Okay, all right. Do we have Peter, Albert Peter, Head CSR for SemCorp Energy?
Yes, absolutely, ma'am. Good morning to all.
Good morning to you, Albert Peter. Please, over to you. Just share what are the main areas of your work and especially what challenges you face in trying to achieve this.
Yes, ma'am. Let me start with something that is it just a tick box that we are talking about? So
that's very important. Yes.
Yes. So I think that all the corporates. So I have been working for, this is my 5th corporate that I'm working. I started from Tata Steel to Jindal and Alkem Laboratories to Rio Tinto. So mainly I've been working in the space of your extracting industries, mining, steel, and power, except one which was a pharmaceutical company. So what I see there is that every company are really honest about what they're delivering in this CSR. And particularly when it comes to your mining, power, steel. So they are more aligned towards the CSR as because there is also a business need which correlates to the community. See the risk. So there is a high risk within this community to work with as well. So I will explain it later how it comes like. So the thing is that the expectation of the community is always on a rise. So if you see these companies, they're located far away and in a remote location. And besides it resides the community where you see that there is a lot of disparity between the people working in this companies and the communities residing beside. So the expectations are huge. Expectation is huge, and the deliverables in CSR are still very less. So that's this match. How to match this is a very big challenge. So, and the second part of it is that in all these companies where I work, healthcare seems to be one of the priority areas. As because when you work within this, I'm talking purely about the grassroots, as because I have worked on the grassroots areas more than being into the policy making in the corporate. And that is again a challenge, how the corporate sees it at the level of policy making and how we implement it. So this match and alignment has to be very, very strong. And that is how the deliverables comes out in the CSR as more, visible area of changes that we make in the community. When we talk about this healthcare, so we are very, very particular to few. We pick up the areas. So it is not that we can go wide into it. So maybe see, if I'm going to do a healthcare, eye care, initiatives, in which I will be very particular to screening and distribution of the spectacles, as because if I touch the cataract areas, so I may be doing good for maybe 500 people or 1,000 people in a go. But if there is one mistake in one eye, then I'm gone. There will be a huge hue and cry, and there will be a dharna and all those sort of thing, and the business is impacted by that. So how do we overcome this challenge? So that is another area. So maybe we thought the other way, that we collaborate. So even if we collaborate, but the initiatives come from the company. So the branding of the companies goes high there. And that is how it is related, that it is the company's initiative. And so this is a huge risk and a challenge that we face. The second thing is that when we talk about this area of skill development, so these are the two priority areas where we have taken health, skill development, and then comes the education. But when we talk about the skill development, this area, the challenges are that in this area, the people are so remotely located that they don't want to migrate from this area to other areas for where they have opportunity of work. So however good we do in the skill development, but the opportunities of employability goes very, very less. And this is always, this is again a big question which is always asked in the board, that what is the outcome of the project? And there I miserably fail. So how to bridge this gap, that is another challenge for me. And the expectation of the people is that you have a big company here, so the operations are going on here. So it is your responsibility also to give us jobs, which is again a big mismatch. So that is another challenge in the area of skill development. Thirdly, when we talk about the last point I will make is when we talk about collaboration. So will other companies or other organizations will be interested to take up my area as to put up their CSR funds and collaborate with us? So that is so that it's the impact is big. It is very huge. So maybe I was working in Chhattisgarh, so which is a very, very remote area. So, and if you want to make a real change, so will they come and participate with us in that area? So that is another area of concern for me when we talk about collaboration. That's all from me. Thank you.
Thank you very much. Thank you very much, Albert. You've made some very, very important points. And one of them, the first, is what I told my team all the time, because we did healthcare for 12 years. There is no scope for a mistake. We did immunization, which was something that there was an SOP, and there was no way that one could move away from the SOP at all. You're very correct that even you may be successful for 30,000 people, but if you go wrong with one, you may lose the faith. So this is one important point that all organizations doing healthcare have to remember, that we are playing with the lives. We are working for the lives of people. We have to have very stringent SOPs and stick to them. And one very interesting point that you brought out on collaboration. For years, we have been talking on so many roundtables about collaborating, so many different corporate CSR organizations. And there used to be things like, whose logo will go where and how will we, at the end of the day, people do their own work for their own thing. So collaboration is a very delicate issue. It's a must. But I think one of the ways, of course, we'll talk about this more, is really to work on the same or similar platforms, but do your own thing. Because at the end of the day, you're responsible for what you're doing. Yes, we can do like some people, we used to get, some people can do the eye testing. Some people can, and then anyone who has a hospital or a surgical background can then take on the surgeries. So we can do it in stages, but it's very difficult, actually, practically speaking, to be working on the same thing together, because there is bound to be friction. And at the end of the day, we don't want the beneficiaries to suffer. So these are wonderful points you brought up. Thank you very much for your contribution. I now call upon Gambhir Agarwal, CSR Head of Relaxo Foundation. Are you there, Gambhir? Gambhir Agarwal, CSR Head of Relaxo Foundation.
A very good morning to all of you. Thank you, Moni ji. And as I was hearing till now that we have been discussing about the challenges and the work which CSR are doing and what should be done under the healthcare sectors. So as far as Relaxo is concerned, we are implementing few healthcare programs, of course, in the rural areas itself, whether it is on eye care, whether it is on primary healthcare services. So I would like to draw your attention over a few things, why a CSR is doing any healthcare program. So what are our objectives over it? So I believe the objectives are more or less same for every CSR, professional and every company also. That is improving the health seeking behavior, increasing awareness and access about the health facilities which are available under the government sectors. Because if we are working in rural areas, then we can see that there are not so many private players available, and if they are available, then their services are not at par or not at we can say we cannot trust them fully. And other few points are what we want to achieve from our CSR programs under healthcare. Yeah. So the other things are we want to save the out-of-pocket expenses of the people who are residing near to our manufacturing units or near to our operations, whether it is on medicine, whether it is on their testings, and whether it is on their other health services, reducing the absenteeism on work, and thus reducing the loss of mandates. And most important thing is the early identification of any diseases. So now coming to the point, what challenges our CSR face? So I believe most of the CSR, if we separate CSR in the PSUs and other companies like Mr. Albert was referring to steel plants and power plants. So this kind of industries I have seen, this kind of industries have established some kind of infrastructure around their working areas or around their manufacturing units or around their power plants, whatever it is. And for other companies, like if I talk about Relaxo, so what we are doing, we are implementing few programs in Rajasthan, that is in Alwar district, in Bhiwadi. So one program we are implementing for avoidable eye blindness, and for which we have partnered with Dr. Shroff Charity Eye Hospital, and we are covering a complete block with a population of 2.5 lakhs. From last 4 years, we are implementing this project. And the other program is one medical health van we are operating with the support of Smile Foundation. Other things, what we do under the healthcare is we are supporting economic weaker section patients who come to Delhi or the nearby from the nearby areas or anywhere in the country for any kind of medical treatment, whether it is a surgery, whether it is a other kind of treatment, dialysis, medicine support, whatever it is. So, like what the work which we are doing, we are not creating any kind of infrastructure. We are just providing a time-bound support to the particular community. Now, when we are providing a time-bound support to a community, we are not capable or we are not targeting to build any kind of sustainable resource of healthcare to that particular community. So so in that condition, our biggest responsibility should be how we can link up the community with the available healthcare facilities, especially the government healthcare facilities, which are not in very good shape, especially in the rural areas. Like if we see the current scenario, almost 72% hospital beds are available in the urban areas only. And out of that 72% is also, out of that 72%, 80% are with the private sector, which is not in the access or with not in the reach of the communities for which we are working. Now, as a corporate, this is our responsibility, how we can bridge this gap. As a corporate, not many of the companies can build a big hospital or can build a any healthcare facility around our manufacturing units. So now this is the biggest challenge.
Thank you so much.
Yes,
you brought up some very important points. Is there something very special you want to say, or can we move on? I want to talk about something.
No, my last point is this: we have to focus and we have to collaborate for the things as how we can develop the infrastructural facilities in the rural areas of India, and especially there is one more challenge I would like to bring. If we are supporting the government structure also, like CSCs, PSCs or SSCs, if we are providing the facilities to them also, then many of the times we have seen that that support is not utilized in a very judicial manner or in very good manner. So this is another challenge with the corporates who are working under the healthcare. So this is these are my points. I submit my
right.
here.
Thank you.
Thank you very much.
Brought out 2-3 very important things which I want to highlight. Firstly, early identification of disease, very vital, very vital. At the time of a baby's immunization, when they are little, if you're doing health camps, if you're working on health, make sure that their milestones are checked, because a lot of heartache and serious diseases can be avoided if we do that. Very, very important. I'm so happy you're doing it. Now, another thing you said was to link up with prevalent facilities, which is good because we do want them to make use of wherever there is government facilities. But my personal experience is we try to do that. I always call the government healthcare and the, doctors and all to come to our camps and to tell, but unfortunately, it's always so inadequate. And here is the importance of today. Because now I hope Mohit is writing all this down. We want him to go to the government. But meanwhile, I want all the corporates. I know it's a bit of a disillusionary task, but please push the local government. They need to cajole and to request, just push. We are doing so much. What are you doing? Go after the DC, go after the commissioner, the panchayat, whatever. When we are doing technically your job, you please come on there and do what you have to improve the facility so we can help you better. At least tell us. But as you have said, that even the money we give them, they don't use properly. So if we are ready to provide that money, why is the ward not better? Why are there no more beds? Why are there not enough beds for the pregnant women. So thank you very much for the points you brought out, very, very valid. And I would request all of you to please don't hesitate, just go ahead, push. We are all taxpayers and we are doing so much good, we have to. And there are a lot of good, very efficient officers also, but then, they're very good to speak with, but do they follow it up till the end? So we have to work harder, sit with them, push them, go with them onto the field and make them improve the infrastructure. Thanks a lot. And now Pooja Thakran.
Mohini ma'am, this is Sanjay Datta. Now I can, if you allow me to speak for 2 minutes.
Okay, all right, Sanjay. All right, go ahead and make it brief. Sanjay Datta, GM CSR Endurance Technologies Limited.
That's right, ma'am. Thank you very much for giving me the opportunity to be a part of the program. And because I have requested for a few minutes because I just joined during that time when ma'am has asked me to.
Go ahead.
Basically, whatever the points which has been discussed and I've heard about that, I'm just saying that if all these things are happening in most of the states because we are placed into the state of Maharashtra, so we are facing the similar things of non-support from the government sectors, and all these factors are there everywhere. So whatever by working in this CSR from last say 10 years in this company, and we have developed slightly, we have modified our approach into that. And what we are doing is because we saw that the facilities in the deep villages, I'm only talking about the rural areas, the facilities, the healthcare centers, which as government has kept over there, their condition is so pathetic that even the villagers are now not interested to go to that center because there is nothing. And when we had gone to the grassroots and we spoke with the healthcare workers, so they are saying that because there is no aid, there is no support, so that is why everyone is whenever they require, they are going to the cities and facing the difficulties. So because we are doing a CSR into those villages areas, so now we have included that renovation and development of that health center as part of our program. Now we have covered up around 40 villages. So there we have rebuilt it we had a permission from them, from the government side, and then on their request only now we have included this into a part. We are not only doing the renovation of the building, but we are also providing the basic infrastructure which is required in the health center. The moment all those facilities are made, yes, we are spending money on that, but once this has been spent over there, and their senior doctors from the city or the government, when they visit, they immediately appoint a proper attendant or healthcare worker into that center.
Right.
And that is one thing which we...
Sanjay, because any other points? But because
second is that we are doing a aged care centers in all the villages. So there we have engaged up with the Kamal and Bajaj, because we are a part of the Bajaj company. Kamal and Bajaj Hospitals medical team has been engaged into that. And every month we are conducting at least 2 camps of old age people and the villagers for general health checkup. So there is a system now which is working, and every month the teams are going there into the rural areas, conducting those camps, and whatever support is required, it has been extended over there. And then people who have been identified with the cataract operation and other severe diseases, they have been facilitated to get to the city and get the rectification done. Basically, it's a small contribution. Yeah.
Thanks a lot. I think.
Yeah, ma'am. Thank you.
Thanks a lot. Sanjay, so you brought out a good point. If there is no infrastructure, you can try and set up something. Now, I just wanted to tell you, we did that in Max India Foundation in Purhul district when one of our group companies was just starting. So we started a small health center. But I was fortunate to have Max Hospital, Dehradun, not very far away. And with a little, pushing and cajoling, I managed to get the doctors to volunteer a doctor to come. Actually, we weren't paying him to come and be there for the whole morning, 4 hours a day. And then also we engaged a nurse to help, and we bought all the equipment and all that, which is a good thing to start. But then, what happens? Then they said there's no urine test, blood test. You can start slowly. But this is a very good idea, because if you're working it's better to do something small, but do it thoroughly. So if you are working in a village, there is no facility, try and get some. Ideally, employ people from the village, but obviously you'll have to get a doctor, and it may not be sustainable in the long run. Ultimately, the government will have to come in, but sometimes they do, because ultimately we found that a primary health center came up about a kilometer ahead on the road, so gradually stop that. So this is a good idea. Thank you for sharing it. And I do hope, because if you adopt a village, we adopted a village cluster in Uttarakhand called Dhakrani. We did multi-speciality health camps every month, and then got an NGO called Bella Healthcare to come and do daily testing, and they had a doctor. So we do have to do things like that,
Yes.
which is very good. I'm glad you all are doing it. It is one of the challenges. Thanks a lot.
Thank
Thanks
you.
so much. I now call Pooja Thakrani. She's here, CSR head of Honeywell India. Pooja, are you here? Then let's move on to M. Uday Shankar, who's DGM Apollo Hospitals Enterprise Limited. May I request M. Uday Shankar to please join in?
Hi, good morning, everyone. So from Apollo, we supporting a lot of corporates across India in delivering community healthcare activities and precisely to talk about the requirement of community healthcare. We in the name of strengthening, because lots of companies today's scenario, they're just offering some kind of a missionary in a one shot, and whether the government hospital has a capacity and capability and employee training is not taken into consideration. And we want to address these gaps, and we're there, and in the name, and we are strengthening the whole ecosystem in the PHCs, subcenters and CHCs. And when we do this activity, we're not just providing healthcare services, we're adding imbibing complete community and making the subcenter or a PHC or a CHC as a point of contact for all the population in the community to avail health services. So for healthcare is concerned, today's scenario, what we see, majority of the CSR healthcare money is spent on doing one health camp. So my suggestion to majority of the corporates, we don't recommend, or personally, what are the activity that we do. So we look for an impact to be generated in the community. So is there any health education given, and what kind of an impact that education has brought into the community? This piece is a little missing in terms of conducting the CSR programs by different organizations. So what we look forward from the corporates and current ecosystem that is there in India. So any activity that the corporates are doing, request them to see the impact, what kind of an impact that we're creating in the community. It can be a pre-assessment of the community, and what is the education that's been imparted, what kind of a change that we got in after conducting a health camp or telemedicine center, or strengthening the PHC, CHC, imbibing whole community, attaching to the community, and after 1 year, what is that out-of-pocket expense that you're able to save for all the poor that is residing in the village. So if these can be taken into consideration, because when coming to healthcare, every organization is conducting good number of CSR activities, but coming into healthcare, people look for, can you do this program for 2 lakhs rupees or 3 lakh rupees, and at the same time, they want to have, for 10 lakh rupees, they want to reach out to 1 lakh population. Because it cannot be just a number game for a CSR in healthcare is concerned. It should be more of a impact that they're trying to get into the community. That's what my submission. And if all the elders who are sitting in this group to consider this point of mine and plan their all the activities that they're taking forward for next financial year.
Thank you so much. You have said something so close to my heart and which is so, so relevant. It shows that you have worked extensively in this field and you have the experience. This numbers game, friends, is something we have to totally avoid in any CSR, but more so on the healthcare platform. It is not important if we've done 20,000 operations or 2. Every life you save is a life. We cannot be careless, and every life is equally important. Slow and steady, build and grow, build and grow. Please remember this. We are not ticking a box. I know sometimes the communication teams of the corporate, you know, they don't really understand CSR and they don't understand the heart and what is happening on the field, and they just want numbers. Please resist. Even if it's the chairman of the company, say, this is what you are doing and it's amazing what you're doing. Come and see it on the ground. Thank you for sharing this. It's an absolutely wonderful, wonderful point. May I now call upon A. Sudhakar, the CSR head of Dabur India, please, to come and speak with us.
Good morning, Mrs. Singh. Thank you again. See, in Dabur, for us, CSR is not since the time we had the enactment from the government. It has been part of our life because our founder said, what is that life worth which cannot bring comfort to others? That is a sort of a stated vision he had when he founded the company. So CSR has been part of the system. Then that's where we set up a sustainable organization called Sandesh about 27 years ago. And when the CSR Act came in, we got more money, actually. That's the only difference with regard to the focus on CSR. We said that, you know, we are very big country. We have so many villages. We felt spreading too thin on healthcare is not a correct thing to do. We picked up 7 states, 100 villages. We said, let us go with an integrated approach to healthcare. That included, number 1, personal hygiene. Frankly, even before Prime Minister Modi started the Swachh Bharat thing, we had started constructing household toilets in partnership with the villages. So approximately 3,700 toilets were constructed by us with collaboration with the households. No community toilets. Community toilets we only constructed in the schools. 52 villages under our management have become open defecation free in the last 4-5 years. That is one part. And continuously, how do we advocate with regard to how the personal hygiene is very important with regard to healthcare, especially the household ladies and the old ladies who cannot use the toilet facilities during the day. It has been our own need survey. That is one part of it. The second part is we felt immunity is a very important issue where due to lack of nutrition support, we always combine nutrition with immunity. If you see in the village, most of them do not eat vegetables. First, because of the cost involved. Second, availability. So that is where we said, why not we start a program called Ghar Ki Bagiya. So we started this program and which helped us in supporting nutrition needs and also exchanging the vegetables with each other and availability and practically at no cost. For that purpose, if the seeds have to be got to the village community, we did it. If any saplings have been, we did. So that is that one part, immunity, and also lot of advocacy with regard to the third thing is we also felt there should be some general health camps and dental health camps for the village communities in the schools and in the community centers. That is the third part where we did a lot of work. And in the feminine hygiene, we are still primitive. We are not there. But other areas, we are frankly, in the next year also, we have taken on ourselves nutrition as the key area for providing healthcare. That is where we are actively working with the communities, and we expect that we should make impact in these 100 villages at least with regard to nutrition support program, whether it is a Ghar Ki Bagiya program, whether it's general health program, immunity health, a combined. And now the schools are also opening up. So last 2 years, frankly, a lot of support which we used to do in the education institution, it had reduced because of the schools were not open. Now, healthcare was the primary thing in the last 2 years, and that will continue in the years to come.
Thank you so much, Mr. Sudhakar. Thanks a lot for all your very relevant points. And I'm glad you're doing a nice 360 kind of thing on health. True, what you said, nutrition is very, very important. You are what you eat. And I also liked your point, which you said that you made no community toilets, only in the schools, because we all know that nobody takes responsibility. And in some village clusters where they have been made, they're in a pathetic condition and they're not looked after. Best is to make them in their own homes. One challenge which I'm aware of in the toilet field is that some organizations, CSR organizations, have made toilets actually without water. So I don't really see what purpose they have served, but anyways, very well done on all your efforts. If there's any particular challenges you can think of, please put it on the chat. Thank you ever so much. I'm now calling upon Deepa Menon, an old friend who's Senior Vice President CSR Corporate Communication at PVR Limited. Deepa, are you there?
Yes, Mohini ji, so good to meet you. Thank you so much. And I'm going to be actually stepping into only 3 specific points. One is just to read out very briefly to everyone here, the Lancet report, which actually draws the evidence of health impact with respect to climate change. And we are very clear, and as most of us have just clearly got to know the overwhelming evidence of the health impact of climate change. Countries have not been able to deliver an adoption response, which is most appropriate to the rising risk which the populations are facing. And it's so evident in 2020 that 104 out of 166 countries did not have the high level of implementation of the national health emergency frameworks, leaving behind all of us extremely unprepared and unresponsive to pandemic and the climate health related emergencies. I also wanted, secondly, as my point of reference, to touch upon how gender inequality or gender equality is connected with healthcare. And it's very, very clear that some of our works of PVR Nest is leading towards that. Gender inequality, of course, is staggering all over. And the statistics that capture the gravity of the problem is even worse. Half of the women cannot go alone to any health facility or to the market because they find themselves very unsafe. 1 in the 4 married women in India do not still participate in decisions with respect to their own healthcare, because that's how, gender has been seen in home and outside. And also in India, 27% of women are in workforce compared to the 50% globally. And in India, unfortunately, we have 15 lakh girls who actually get married much before 18 without, their health consent. And hence, we actually still, have the highest number of underage brides in the world. So there is a very clear connection of gender inequality and the health issues which community faces at ground. Very briefly, I want to touch upon that a lot of work which we used to do with children and protection got completely swiped off due to pandemic. And the last 2 years, actually, the most recent program which we were starting off with the city with respect to the protection of women and bringing inclusion on equitable urban spaces turned out to be a bigger program. And it's no secret that women and girls continue to be excluded from the most urban spaces, even either owing to the attitude or the lack of infrastructure that restricts the access. So I want to share with you that as part of the, the UN Sustainable Development Goal, keeping in mind gender inequality as well as healthcare, we went ahead and collaborated with the municipal, that is with the central government, with the MCD. And this is a very specific program, Mohini ji, you may not be aware of. We kickstarted in May 2017-18 to collaborate with the government and with the advocacy, and very clearly articulated and mentioned by Sudhakar ji that we need to open space for sanitation and hygiene facilities so that women have access to that space. And PVR Nest collaborated with the MCD to kind of fulfill this gap, which is to provide the essential safe infrastructure which is addressing the problems which are also surrounding to support systems as well as childcare issues around. And hence, we would now, in the coming time, collaborate with not only government corporates, but international organizations to set up the first female-friendly sanitary complexes, which are going to be available, which are going to be safer, which are going to have accessible sanitation spaces exclusively not only for women, but to provide care for children, which also helps these spaces to become more and more in the city and can turn out into doing many other activities with respect to their health facilities. And hence also, brings the presence and increase accessibility of women in the urban cities with respect to the marginalized and the socially disadvantaged community. And these are big state-of-art facility which comprises of not only washrooms, toilets, but also breastfeeding areas, children's diaper changing sections, incinerators, because finally we have to lead into a climate health center where these incinerators do provide safe disposable mechanism of what women require also at public spaces, and central hygiene equipments, etc. So I think I just want to step out of this chat by saying that we have experimented some collaboration very, very recently with multiple organizations. Our challenges have been the different vocabs which are required to partner with multiple organizations like WaterAid. I remember when we had to call a toilet that had to move into a center look. From a center, it had to become a pink center. From a pink center, it had to actually have a climate health center outreach so that I could bring in a UNICEF, a WaterAid, a MCD commissioner completely interested in the program. So I think it was a lot of new vocab, new articulation, which was required with different agencies to come and collaborate. I just want to invite all of you to see this physical site, which is coming in Delhi, in Karol Bagh, in one of the socially disadvantaged area where the center will be up, which is going to be a healthcare center, which is certainly talking about, this collaboration and close to around 30,000, poor disadvantaged families.
I request you to just give the details on the chat. Thank you ever so much.
Thank you.
You've brought out this point of gender equality, which is very, very important and true, that healthcare is so closely tied to it. And women's health, especially on Women's International Day now that we are talking about it, women's health is the health of the nation. So it's a very, very relevant point. Thank you for that. And I request everyone to focus on this and follow your footsteps as well. And on the point of collaboration, I have to tell everybody that Max India Foundation and PVR Nest worked together for years and years, where we provided all their children their immunization and health camps. So thank you and all the very best, Deepa. I now call upon Dr. Lopamudra Priyadarshini. She is the General Manager, CSR, Hindalco Industries Limited from the Aditya Birla Group. Please, are you here? She's General Manager, CSR Community and Relations, Sustainability, External Stakeholder Management. No? All right.
May I take the slot, ma'am?
Sorry.
Yeah. Go ahead, madam. You perhaps were calling my name only.
No, is Dr. Lopamudra Priyadarshini here?
May I take the slot, ma'am, if possible?
Sorry?
Praveen Khan this side. May I take that slot if possible?
Right,
My name is Praveen
please
Khan.
continue. Praveen Karn is Group Head CSR of Spark Minda Group. Please continue.
Thank you. Thank you, Mohini madam. Thank you for CSR Network for having me here for the day. Very, very important deliberation, that too in the time when we are likely to recover from this pandemic. And I just heard a new terminology called endemic. is that the one? I mean, if that is, then in that case, we all, fraternity from development sector, corporate social responsibility sector, we all have certain owners, certain responsibility to execute. Well, the government of India has been doing a lot of work. The state governments have been doing a lot of works for healthcare. You look at the, all the way from CHCs to PHCs to block offices to district administration, district health administration, they all have tied up their hands and they have been executing a lot of responsibilities. What can we do here as a corporate social responsibility leaders from the sector? Well, for those organizations who have been doing the healthcare programs in a very organized way, I believe it is going to be set of expansion of scale up for them. But for those set of organizations who have neither initiated the work in healthcare, nor they have allocated budget for them specifically, I would like to highlight my points. The need assessment for the healthcare is very important. We generally get into any community by doing a health camp. The health camp is fine.
Tell us what are the more the challenges that you faced?
I was likely to come to that point.
Talking, what are the challenges you faced? Is this something that you found it was difficult to execute your projects?
Oh, for sure. I'll come to that part. For the challenges that I have faced is one of the major challenges that we faced is identifying the real need of the healthcare, be that in the preventive set or curative set. How do we identify that? And like, are we capable enough? Are we equipped enough? Do we have the right set of professionals to identify all those needs for the healthcare? That's one of the challenges.
The others, please mute themselves. Well, there is a lot of disturbance.
Okay. Is it better now?
There's a lot of disturbance.
Is it from my background? Okay. All right. Shall I go ahead? All right. The second set of challenge which I have faced, that at times we have been doing those set of programs which are already been done by the government. We need to segregate that. That overlap should not happen. It should be in the form of a supplementation. The government of India already has a beautiful program, which is one of the largest healthcare program of the world. Although I heard a few speakers, they were talking about the allocation of budget from the GDP, which is lesser in terms of percentage, but still, I feel as if with this such a beautiful NHM program, we can be a supplementation. This overlapping is a challenge. We need to identify what do we have to do. That's second. Third, the infrastructure, that too in the rural parts of India, is one of the challenge to be built. And creating a health infrastructure is a bigger project. It's a very sensitive, very important project. And need to have that scientific idea, you have to have that research, the need of that area, and then accordingly you can execute that. Fourth is that if your organization have been doing certain set of thematic works, and then you are planning to allocate a new budget for a healthcare program, it is difficult to convince to the board. But this is the right time, my friends from the development sector. We have seen this pandemic and we can talk, we can advocate about it, and we can have this allocation, which appears to be a challenge to my understanding. Last but not the least, I would say that we should always look at the pre and the post assessments for the work that we have been doing. I have seen that there's a lot of healthcare programs being done by my friends from the development sector, but they haven't been mapping the impact of those healthcare programs. So how is it happening? Or do we have the right set of partners who can actually do the real impact assessments for the projects that we have done? I would end up by saying
so much.
That
yes,
yeah, I would end up by saying one line, that we can be the part of the government system also to execute the healthcare program. Or if we are doing a healthcare program, we can integrate, we can include government also to be the party to this. Thank you very much.
Thank you so much, Praveen. Karan, we are now a little bit running, I think, short of time, so I may have to rush a little. Thank you so much for all your inputs and your experiences. May I call Aman Kaur, Senior Management from Bajaj FinServ, if you're here? Aman Kaur?
Hi, Mohini, I'm here.
Hi, please carry on.
Yes, so currently I'm working with Bajaj FinServ CSR team as the team lead. But we've worked comprehensively as Bajaj Auto and Bajaj FinServ, wherein I will quickly, because that they're working in the CSR space is well known. I'll just quickly highlight the challenges. The work of Bajaj CSR spans from environment to maternal health in the health space. They cover all of it in spaces which are non-accessible, meaning to say the highest and the toughest of altitudes in Uttarakhand to the forest terrains. We work with organizations which work in Naxal hit areas, Gadchiroli, Mahan Trust, AAA. Ours is a model wherein we work with collaboration with NGOs who are established in that space and also fund very small NGOs so that they can start to build up and provide capacity building. Also, we've been doing a lot of direct implementation in the urban slum space for the maternal and child health care. Having said all of that, I would just like to point out 2 3 things which arose from the pandemic. One is the utilization of equipment. What happens is whenever a request for any equipment comes, somehow there is a temptation to get into it, right? And so that the fund utilization is done, and it's okay. The only thing to highlight here is when we draft an MOU, it should be noted that uska utilization, the reports, it would be accountable by the organization that it is being given to. Even so, if it is in the case of the government setup, they will send a monthly report, and if they are not able to use it, they should be okay with transferring the asset. And I speak from experience which comes during COVID, where in oxygen plants and there was dearth of oxygen, and the only intervention that seemed necessary then was oxygen plants. But when you now look retrospectively, you realize Tata's did it, all of us did it. What happens after that, right? So equipment and infrastructure are heavy on the capital, but the judicious utilization bit needs to be seen. Then when we talk about community interventions, something which I have gathered from my field experiences, talking to the field level workers, and it's ashas, it's the field workers that are hired, because what is designed at the top level and what happens and trickles down at the down level, at the implementation level, there intends to be a gap. So when we go to monitor, when we go to have a vigilante over the space, we need to be very clear about what we're going to ask the field level workers, right? We've had certain instances where we realized that there was a disjoint or there was a gap there. So those 2 points I would like to make, because I'm a public health professional also. I worked in WHO, the World Bank and ministry, right? You're on mute, I think, Mohini ji. I couldn't hear you. Hello. Hello. I can't hear you. Can anyone else hear her?
We can hear you. Please carry on.
All right. Mohini ji, I think you were speaking. You're on mute.
Yeah. Mohini ji can't be heard.
Yeah, I can see her speaking, but I can't hear her.
No, her mic is muted.
Yes, and I don't think she can hear. She's trying to say something. I'll just. Right. So those were the inputs from my end, and I was just going to bring in that having worked as the surveillance medical officer for WHO or the World Bank or in the ministry, I've realized interaction at the field level is of utmost importance. So those were the 2 key highlights I just wanted to bring up here, seeing that we intend to get into all of that when it comes to healthcare space. And another thing is the measurement and impact this thing. I think Mohini ji made that point. We don't need to rush into measuring the impact. It is a long drawn process. We're talking about health of a person. You cannot see the results in 2 months. So those things from my end. You're still muted, Mohini ji.
We're trying to get her unmuted.
All right. Okay. I think there's some system problem. This actually brings me to another point. The use of technology. We expect the field level workers to be pro at it, and we need to be a little more patient with it. We expect them to understand everything. We expect them to upload everything. It doesn't happen. We need to understand that also. We need to be considerate there.
Right.
Right.
Okay. I think I can now be heard, right?
Oh, yes. Yes, yes.
Okay. I've come back. Sorry. I somehow had lost something.
I think it was some lag.
Well, thanks a lot, Aman, but thank you very much for your inputs. I just want to say before we start on the next speaker, there is too much disturbance. Request, please, everybody, mute yourselves. There was too much talking going on, which is really unfair for the person who is speaking at the moment. So please mute yourselves. Thank you so much, Aman. And I now call Soraya Rebello, Head CSR from the Jackson Group. Are you here, Soraya?
Hi, I'm here.
Okay.
All right, excellent. So I think in the beginning, there was a point that Mohit brought up saying,
Can't hear you.
There's a weak signal at your end, I think.
We can't hear Soraya.
I think the rural healthcare system is something that is being neglected to a large extent. So having said that, we as a company may not continue with healthcare system, with the healthcare SDG or the healthcare aspect.
Sorry to interrupt you. In the beginning, initially we missed you. So could you just repeat yourself? We didn't hear anything.
Oh, okay. Was that the same for everyone?
Yeah, no, we missed out a bit in the middle. Yeah.
Yeah,
Okay,
everybody missed out, actually. Yeah.
All right. So where do I start from? Let me start from the beginning very quickly. I'm referring back to the point where, Mohit had mentioned whether companies would continue with healthcare post-COVID, because many companies went into healthcare during COVID. It was never an SDG of the company, but they got into it. Now, what I said initially is that we were also a company that got into healthcare during COVID. So after the horrific month of March 2020, I think healthcare became the need of the country, and a lot of companies pitched into doing whatever they could, whether it was PPE kits, oxygen cylinders, masks, ICU equipment. There was so much, and we did all of it. Even we as a company did all of it, although we had never tapped into the healthcare segment earlier. Our forte has always been quality education and environment sustainability. But having said that, I think healthcare is very critical. Like I said earlier, rural healthcare system is very important. It is being neglected. I think urban healthcare is far more better. You have a lot of private hospitals existing, the biggies, and healthcare is an expensive affair. Now, how does healthcare reach the marginalized sections of communities? I think that is where private and public partnerships play a very important role. But for companies that are serious into, healthcare, I think what is really important is that they need to understand it is expensive. They need to make it accessible. And at the same time, there has to be accountability. So it's not about, providing equipment or doing a one-time sponsorship or, putting a couple of lakhs or crores into a hospital or a project. I think it is very important for accountability to take place, even if it is a government hospital or you are tying up with the government. Because maintaining that facility is really crucial. Also, the quality of healthcare workers that you have, that becomes very important. Are healthcare workers trained? Can private companies help in skilling of healthcare workers? Because that becomes upgrading them, with technology, with probably knowledge. All this becomes very critical. So, is that going to happen, or is it just going to be a one-time donation or a one-time sponsorship? I think these are some of the questions, or these are the challenges that continue to remain. And
right, thanks a lot. Is there anything specifically, any particular point, because we just need to move on a little bit? Any particular?
I don't think there's anything else in particular, but I would like to focus on accountability. So
sure, accountability and training of the healthcare workers, which is very good, because it's also the need of the hour. And as you said, healthcare has always been important, but very, very much so post-pandemic. Thanks a lot. Thank you, Surya. Do we have Sudha Jajaria here, Senior Manager CSR from the Fortis CSR Foundation? Do we have Sudha here from Fortis Foundation? Okay, we don't. Then can I call Praveen, CSR lead from Max Healthcare? Praveen? Praveen, CSR lead from Max Healthcare? No? All right. Anupam Bajpai, Chief Manager, JK Tire Industries Limited. Vinayak, Healthcare Vertical Head from Ambuja Cement. Vinayak?
Yes, ma'am.
Okay, can we have you, please?
Yes, ma'am. Thank you, ma'am. So very good morning. We as a ACF, very large implementing organization, working in almost more than 2,500 villages across India. With health is major focus, definitely as one of the thirst area. And we largely work with the community, being an implementing organization. So we directly have a direct implementation program with the communities. And we majorly have focus over the year to, create the village-based organizations, whether it's SHG groups, women federation, farmer producer organizations, or village development committee for that matter. So importantly, we always involve the committee when we actually roll out the programs, and that really makes it more sustainable and impactful for the community. We'll just share 2-3 case stories very quickly. We are trying to work with the government. Of course, local health department actually very much accessible. Definitely, there's a lot of challenges we have realized when we rolled out a maternal child health programs. Of course, there is a lot of challenges on neonatal mortality or infant mortality. Simultaneously, there are large incidents happening on non-communicable diseases, and we're trying to approach the government for the same. But ultimately, for the government, also the issues of MC is still much of prevalence, so the NCD is not really being focused, and the cases of MC is really increasing into the village level areas. So the infrastructure, availability of medicines, accessible to having a specialist care is something very much challenging. And we as a ACF has rolled out the interventions in more than 170 villages, and now we've seen that government also is using the same government guideline which we have used to use and implement the programs for the NCD interventions. So that really helps a lot when we have a local partnership with the government. We also have tried to work with the local CSR partners to roll out the programs. But simultaneously, of course, when we work with the health domains, that's more a process-oriented program, and not really measure of infrastructure or related interventions. And then many times it's a challenge to brought in the CSR partner as well. So that's really a need to be focused. But one case story, but we have created a committee clinic where we created village development committees. So all the contribution being done by the villagers, medicines also being procured by the medications. ACF only providing a technical support through a doctor and paramedic, which goes on a weekly basis, providing healthcare. But that healthcare is available at the doorstep. So that has really addressed a lot of challenges, having the medical facilities available. So NCD linkages, NCD linkages to get the treatment is really, made available through as a model of the community clinic. About speaking on the menstrual hygiene management, same SHG groups and one federation was made a part of this momentum, and we created a program for menstrual hygiene management with the 4-wheelers, and that actually focus on awareness, access of the menstrual absorbents, wash, basically that need to be impart the knowledge about the management, and also the disposal part. So we have made these units, to manufacture biodegradable sanitary napkins, and then as ACF rolled out this intervention to the Sakis, into the schools, into the villages, so this all women cater, and that has really turned out very well, because that's now a sustainable model, which was a learning for the COVID, which is not having some access to the menstrual absorbent. About toilets, ma'am, same way we have, all this one federation got a revolving fund from GIC. All this revolving fund used to construct the toilet at each household, and all this fund was then returned back to the, to the bank. So that was really a good case story which is created out of this. And I think this is what, very important to have a village level participation, which takes the programs, in a sustainable way. So that a few sharing from our side, and we're going to focus on
so
malnutrition and NCD in coming time across all the locations.
Thank you so much,
Thank you, ma'am.
Dr. Nayak. And your point about participation, that is very, very important. Participation of the beneficiaries, that is what makes your work sustainable and makes it so much easier. And that is something that, they should be made stakeholders in whatever one does. Thank you very much. That was really very nice. May I now request Mr. Raman, please. Should I? Okay.
Yeah, thank you, ma'am. I just have a quick.
Yeah,
yeah,
absolutely.
Totatri Raman, that's my name. It's a bit complicated. Yeah.
I was afraid of mispronouncing it. That's why
I totally appreciate that. Yes,
he's
ma'am.
from the CR Trust, Totatri Raman from the CR Trust.
Thank you, ma'am. I come from the space of assessment accreditation, international accreditation, and I'm also from media. I was the executive editor of Business Day Mag. That's briefly who I am. I've been working in this space for more than 20 years in this the space for standards and quality improvement in education, but particularly MBA education. That's my area. So from that perspective, I just want to make one or two quick points. The title of this discussion was basically whether it's CSR investment is a tick or a strategic investment. And so far, whatever that we have heard, that aspect has not really been, touched. I would say that. I think we need to have more discussion about how strategically this one benefits the companies or the institutions which are spending money. This is one point. Part of the same point, I would only say that so long, see, the accreditation standards also insist that you should have voluntary compliance. It should not be compulsory. If CSR is made compulsory, then chances of it becoming a strategic investment is limited. Then it becomes just a tick because every company wants to be there. So therefore, there will be there doing some CSR activity. So to become voluntary, then it becomes more sense. That's one. Second thing is the investment that is being made in CSR, even across the companies, is very meager when it comes to community healthcare. That's not going to shouldn't be the focus of the companies. It should be more for building awareness about healthcare and also specific to that company. If it can impact in the environment in which they are there, that is what we call it business environment in a real sense of the term. Finally, I mean, the last point that I want to really say is that I think as a community, we should be really developing a system of accreditation, probably an ombudsman, some sort of a common council or something like this, where we should look for CSR funding accountability, and not just accountability in the strict sense of the term. It's more to do with advisory. If you are able to have that sort of a small, industry-wide council and appoint a board, I think it will work. Thank you very much.
You've actually brought out a very important point. Thank you so much, Mr. Raman. 3 points. Now, firstly, the advisory. This is exactly the point, and I think Mohit Gandhi is planning to take this up with the Niti Aayog, that National CSR Network could offer a sort of a framework for advisory and to capture impact. So that is one, your point. Your first point about whether it should be voluntary or not, I think that ship has passed and we are already in that space. So, it is CSR professionals like us who feel that we would do it anyway. But to be honest, if you're looking at the corporate, the business part of yourself, they will not necessarily do it if they didn't have to. So sadly that. Now, the point about whether or not it is ticking, one or two people spoke about it. I think Albert said, and somebody else said that, you see, none of us will say that our work is only tick the box. I think, as you're saying, something partial, somebody else has to say whether you're only ticking the box or you're actually making that difference. So, that is why nobody's really saying it. In some ways, yes, we say when people just go out and sit down outside a school and say, haath dho or ye karo. So unless it is a consistent effort on health awareness with different topics, more than people know, then it's not health awareness. So I think we should agree on the fact that certainly a certain amount of tick boxing must be going on. But as far as the CSR heads are concerned, no, that's not what they plan to do. They're really wanting to make a difference. So thanks a lot for your inputs, very valuable. And we are taking on this advisory role. We are trying to get the government to agree to let us do something in that space. Thank you very much. Can I now request Praveen Bhaskar, please, National Head Training and CSR from FinCare Small Finance Bank. Is Praveen Bhaskar here? I think his computer's on. I don't know if he's here or not. No, okay. Vivek Prakash, Vice President, Corporate Social Responsibility, Jubilant Life Sciences. Vivek Prakash. Praveen from Max Healthcare. Okay, Surya Dev Singh, Head Admin, HR and CSR. Radha Raman Group of Industries, Surya Dev. Vinod Simon from the Sways Limited. Vinod
Hi.
Simon. Hi,
Hello.
whoever it is, please come.
Yeah, this is Surya Dev Singh from Radha Raman Group. I believe you have.
Yeah, Surya Dev Singh. Yes, I did call out your name. Hello.
Yes, ma'am. So thank you so much for inviting me. Actually, I'm not in my office. I'm somewhere
No
else.
worries. You are.
Yes. Yes. So first of all, I would like to thank you and your team for such a wonderful session. Earlier, I was skeptic about joining because I was not having time, but I found it very interesting. So basically, I'm heading CSR in Radha Raman Group, Bhopal. So as you know that because we are an education institute, so this is not a foundation for us to have fun. But since CSR is something which is a moral liability, as one of the speaker earlier me who told that until if it's been made compulsory, the chances of getting it successful is something not that high. And I would also love to quote Mr. A. Sudhakar of Dabur. I heard when it was not a law. Since then, Dabur have been doing for this kind of activity. So one line I would like to say, then I'll come to the point, the problems that in college also, when I started the five that we should have some CSR initiative, I got some kind of this thing that why do we need it? So it's so simple as that it's a moral responsibility of all of us to have some helping hand to others. So this is how I believe in this philosophy. Number one, this is just an orientation. As far as the problem is concerned, that since we are a teaching institute, we don't have any fun for that. We if I want to show you, this is a gym I'm getting constructed. So this is a underprivileged area where the young bloods are indulging in smoking and other activity. So we thought to donate a gym so that the young bloods, those who are teenagers, don't have competition of smoking more cigarettes than the competition of having stronger biceps. So this is what we believe. And as far as me is concerned, because I think that in this particular the whole gathering, I am the person who is from the other side of the table. So what we believe, we professors, we contribute little of savings, and then we do some CSR activity in the underprivileged area, so that we do it for education. And as far as one thing, the last thing I would like to mention, that we have spoken a lot about health. Now we have not covered the mental health. See, because I have been into teaching for last 15 years, the ethical quotient, the emotional quotient, what used to be in the students 10 years back is not there. The students of these era are getting more, stressful. So we are doing something for this particular, to address this particular problem of the society also. So I will be, because I believe that the time is very less. So I will end up here, that I will contact you people if anybody would like to come into this particular area of mental health, so that the younger generation is a better human, a better Indian, a more empowered Indian. Because getting so many social media, FB, YouTube, and these are the power tools, and any power tool which is used unethically has got dangerous effect. So thank you so much, madam, for being for around.
Thank you, Suryadev Singh. You have brought out two, three very important points. One is mental health. Though no one has spoken about it, I do believe, I'm sure people may have been working on this. I'm not sure. You see, one of the things, doing co-curricular activities with school children, organizing sports for school children and tournaments, like you have made the gym, this all goes towards mental health, because it keeps the children's minds productively engaged in bettering themselves and keeping them away from depression and ills like drugs and smoking and other things. So this is, I think, unknowingly people do it. I mean, I keep talking about my experience, but that's all I have. In Max India Foundation, since I had the facilities of Max Group, the head of the psychiatry department was a good friend, and I would request for interns from their department to speak to all our NGO children. We had a NGO called Jamgat Group of Street Children, where the street children had been brought together. They were made to stay in good homes and sent to school. So I used to send the interns to talk with them, and also with other NGO kids. And our own team members used to interact. So they were also well aware, and they were told that you need to communicate. And here I want to tell everyone, especially those who are working with women, people, please communicate. That is the key. Women are burdened with a lot of things they can't talk about. Ghar mein kisko bolenge? Husband is not listening, there's not time, and half of the stuff is about his drinking and other problems. They need an ear. Please give them your ear. Please speak with them like Sakhi, not talk down to them, with empathy. Baate karo, checkup kara rahe ho. You know, when people are waiting in a line to do checkup, when my team or the doctors, I used to go down the line and chit chat. Tumhare bacche kitne, kahan school mein padhte hain, kya hai, bacche ne jute kyun nahi pehne. Little communication points are what will give that person little bit of confidence and will make them feel special, and then they will share problems. So please communicate. And mental health is a fantastic point that you brought up. It is the need of the hour, not only in the underprivileged, I think even in the employees and everybody. I think that is what is causing all our diabetes, hypertension, and everything else. And we must reach out in whichever way. The best way is to engage people productively, organize dances, singing, organize sports, organize gyms, make competitions for women, for everything. I think that is really good. Thank you so much. Now let's see who else we can call. Is Seema here? Seema? Anyway, I'll just go down my list and see if there is Anupam Bajpai here? Dilip Kumar Das, Head CSR, Balmer Lorry. Ashwini Saxena.
Yeah, ma'am, I'm there.
Okay, Ji. Great. Okay, so we have Dilip.
Yeah, let me come to the point straight because it's time up.
Company.
We are a 156 years old company, and we have been investing on health since beginning. And as an, this Bamal Company Limited is a government company. It's a mini Ratna PSE. So in pandemic period also, when government said that you should install an oxygen plant, we have suited up our budget to 100%. It's 200% now. So we've invested a lot in health. And being a government agency also, we also face difficulties. The challenges are, if you go to a government system to strengthen them, it will take hell lot of time. You need to aware them, you need to skill them, and then they can, do their activities. Otherwise, it's not an easy task. I'll give you an example. I bought an oxygen plant immediately imported from China, and it took 8 months for a government to set up the machine and start the engine. So there we have to have a patience, and we need to induce the government system. And, we cannot do it alone. We need to have a collaborative approach, which Albert also has said, that we have seen many, merger and acquisition, but there are few examples where NGOs have come together or the companies have come together to do a project. कभी-कभी बिना पैसों के भी बहुत कुछ होता है. You know, I have a platform, I have a space, I have a community. You can always come, you are welcome and do your activities. For example, if someone is, doing a cataract operation or distributing a glass, they can always come to us and approach us. We do not need money. We'll give you a space, we'll give you a logistics, you do and you can go back. So that kind of, ownership should be there. And lastly, what he said, we always talk of physical health, but we actually miss out that mental health. Well-being, what does we mean to say when we say well-being? Well-being means physical and mental both. It's not only physical. And it's a developing country, and health needs to be focused down the line to 20 to 30 years, because we have people living in villages. Their health seeking behavior is very poor. We need to aware them कि आपको बीमारी है, आपको जाना है hospital में. And there is a government program, huge program, NRHM. There's one program, it's a cashless delivery. The moment you conceive, you are pregnant, you can come to the hospital, you deliver a child and you can go back to your residence without spending a single pie. But people do not know. People are being charged for that delivery system and all kind of things. So these are, some of the point, mental thing and, identity crisis. There shouldn't be any identity crisis, because at the end of the day, we should benefit the community. If I have an organization, Bamal Company Limited, and the X company comes together, it's not that I lose my identity or he'll lose his identity. But at the end of the day, they should be benefited. The community should be benefited.
Yes.
So these are my 3 points, nothing more than that.
You're right. Thank you so much. You made some very telling points. We must collaborate, and there's no egos involved. If arrangements are made properly, and we can have, whatever, we can sign agreements and whatever. But very good. Well-being is what we need to focus on. Thank you so much. May I now call upon Shrestha Verma, the Director of IDCL India Private Limited.
Hi. Okay. Thank you all for such insightful points. Our company doesn't do CSR. We're a CSR consulting firm, but we are trying to get on board with what everyone has been probably pointing out as the idea of collaboration. So there are a few things that we feel that are challenging in this space right now. One is that having an idea of collaboration is just not enough. It's also about seeing the opportunity that lies behind it. So the idea has to be that everyone has to put forward their requirements in order to get the right kind of response from the other end as well. There are a few things which everyone has mentioned, which are really something that in the 2022, at least the financial year, everyone should look after. One is definitely the healthcare, the mental health. Second is we have to more shift the focus more towards the green healthcare practices, such as what PBR is doing, and look at sustainability of everything as well. Climate change definitely is affecting everyone. So that's something which should be a part of your healthcare policies. I would honestly, just to look at it as a positive criticism, I would do go out and say that, from what has been happening in the healthcare sector from the CSR front, we are ticking boxes, because there is absolutely a lot of opportunity to go out of your way and to bypass what the government is doing, rather than just trying to be something that contributes to it. So there is the amount of the money that, at least in this panel right now, could be probably more than 200 crores. If there is a collaborative approach, there is a lot of chances that there could be something that you can look after in terms of technology and advancement of technology in healthcare, rather than trying to support what is already existing. Definitely there is a need for going down and penetrating what is already there, and government is trying to do that, and there is a lot of positive reinforcement by the government into public healthcare. If you look at something like what the Rajasthan government is doing, they're trying to provide a universal approach and free healthcare for everyone. Definitely, it will take time for it to grow and work at its optimum self. But that will also happen when the companies who are there on this panel right now focuses on how the future of it lies, rather than the current situation, because they have the capacity, they have the means to overcome that bureaucracy and red tapeism which the government doesn't go through. Also, definitely definitely the numbers game and etc. All of that is something that we have to overcome in order to look at something in the future and not look at it as it is happening right now. Because as we have seen, we have come only so far in the healthcare game in terms of CSR, but there is a lot more opportunity, and that's something that, you know, as something that we do with the people we work with, we try and get them on the same platform and have them look at the bigger picture and be like, okay, you don't have to look at it at the next financial year, look at it for the next 5 and 10 financial years, and then see that how big the change that you can bring about and what it is going to bring as a holistic change in a particular area is going to be like.
Right. Okay, thanks a lot, Shrestha. Now, I actually feel that you are the most important attendee on this. I hope you've taken the inputs and noted them down of all the CSR, because if you're consulting, you should know, because these are the guys who do it on the ground. It's easy to sit in an office and say, do this, but the people who actually do are the ones whose inputs you should incorporate. And I'm sure this will help you to do better consulting. And thank you for being there. And we will all, of course, be. Though we will look at the bigger picture, but let me tell you, we will first focus on the small things and grow bigger. Because healthcare, you cannot compromise. So thanks a lot. Now, there's so many people here today who know they can go to you for advice. I'm sure they will. Thank you ever so much for being here. Now that we have very little time, I'll quickly read out the names of those who have not spoken yet. If anyone is there, please stop me, because I don't want to just call. I had called earlier Dr. Neil Ratan, but wasn't there then. Lopamudra Pridarshini wasn't there then. Ashwini Saxena, CEO GSW. Sunil Kumar, Valvoline Cummins. Aradhana Dubey, General Manager, Luminous Power Technologies. Sunando Majumdar, Graphite India. Nonika Rajkumar, Canara HSBC, OBC. Okay. Amit Chaudhary. Okay. Shalini Singh. Vivek Prakash. Praveen from Max Healthcare. Vinod Simon. Seema. So, friends, it seems that we have, I hope everybody who's on the platform today has had a say. It is very important, and I must say very important to hear, first to say it, but to hear what other people have to say. And most of us, I think, are quite agreed that what we are doing is a lot, but it can never be enough. And healthcare, we know on the ground, is in a precarious place. And we have suffered in the last 2 years even more, when even very serious diseases like cancer could not be addressed. Okay, now I think we have Dr. Arun Kumar just on time. Perfect. A very warm welcome to Dr. Arun Kumar. I'm so glad you could join us. He's the president of the Delhi Medical Association. He is a pediatrician. And he is, I just love inviting him and hearing, because he's so keen to know. He's keen to know what others have to say, because he's so much of a person who wants to make a difference. He wants to improve things. So in spite of all your very, very busy schedules, I'm so happy you could be here. We will share everybody's views in a more detailed way. But over to you. आपके क्या ख्याल हैं कि CSR on the healthcare platform में हम लोग सब और क्या कर सकते हैं to make it better? Thank you जी.
पहली बात तो मैंने लास्ट 2-3 स्पीकर से सुना, मैं 15 मिनट पहले ज्वाइन कर गया था, तो I must congratulate Mohini ji and his team for like starting this kind of dialogue, roundtable dialogue, where everybody can enrich and get some information. And जहाँ पे CSR की बात है, मेरा जो experience है about CSR is the part of being think tank of Delhi government. Now we are in government in Delhi as Aam Aadmi Party. I'm the advisor to the CM and Health Minister, the Education and Health. Because Delhi is not a full state, and we have a lot of troubles, like a lot of obstacles to implementing our policies. And I say so many times, these NGOs which are funded by this CSR initiative, they come to our rescue. whether our education plan is there, health plan, there are even big plans. Because the fund is not coming, there can be so many bureaucratic hurdles. So these NGOs and CSR help us at so many fronts. In especially in our education front, whether the happiness curriculum or this curriculum, ultimately we look towards you people, and you people always help us. So I think that's how I came to know the importance of CSR in a governance. They can make a impact in large number. Initially, I thought कि NGOs slums में काम कर लेती हैं, खाना बांट देती हैं, ये कर देती हैं, but I could now realize they can work at a much larger scale. And as personally, I have for last 10 years I'm working with so many people. Slums के अलावा even जनता flats में भी मैंने देखा जो लोअर मिडिल क्लास के फैमिलीज होते हैं, उनको भी बहुत रिक्वायरमेंट होती है. खासकर कोरोना के बाद वो lot of them like went down to the poverty line. And as a group of people, I have a group of volunteers working with me. We take care of almost 2,000 elder couples, like elderly couples who don't have anyone to support them. मेरे पास 2,000 की लिस्ट है जिनको हम लोग लगातार, तो आप लोगों में से ही लोग फंड कर देते हैं या कुछ दे देते हैं, तो हम उनको सपोर्ट करते हैं. So not only we give them it's that kind of materialistic support, but also emotional support, and in time of need we are there. We just celebrate their birthday also करके उनको हेल्प कर देते हैं. और during COVID हमने देखा है जैसे हमारा Delhi, we were feeding 10 lakh people per day during lockdown. जो लेबर दिल्ली में स्टैंडर्ड 10 लाख लोगों को हम लोग खाना खिलाते थे पर डे, और वो खाना कहीं ना कहीं आप लोग ही फंड करते थे, क्योंकि सरकारों में इस तरह के सडनली निकालना आसान नहीं, तो सिस्टम हमारे बना रखा है जो. और बाकी पर्सनल फंड में मैंने देखा आप कहीं ऑक्सीजन कॉन्सेंट्रेटर चाहिए, तो हम सबसे पहले कॉल किसी एनजीओ को या किसी सीएसआर फंड वाले को ही करते थे, और वो लोग फटाफट काम करते थे, क्योंकि उनके यहाँ आई थिंक वो ब्यूरोक्रेटिक हर्डल्स नहीं होते. They have their own way of working, so that is much faster. And मैं लास्ट में मोहिनी जी कह रहे थे कि कैसे करना, तो I can help you in two ways. I am the president of Delhi Medical Council, which is the largest body of doctors, the regulatory body of doctors. So we have 50,000 members in, and Delhi Medical Association he has a political body. This is also my team is working there. So we have 20,000 doctors of Delhi working with me, so we can use them. And of course Delhi government में किसी भी तरह का आप लोग दिल्ली गवर्नमेंट की हेल्प चाहिए to implement any of program, I am always there, and I can always talk to the health minister and the CM. Plus Dolly, my wife, Moni ji knows very well. Now she is the chairman of Delhi Social Welfare Board. You can catch hold on उसके पास she has 19 FCCs, that is called Family Counseling Center. They have full-time paid counselors who are working in the society, and you can use those counselors also. Secondly, she has made a group of more than 100 volunteers who want to work for the society. So that is a very big number, and practically we are scattered all over Delhi. So Moni, you can always talk to Dolly. She is very energetic, very enthusiastic for this kind of public work. So we can work together. She can use that platform, Delhi Social Welfare Board, which is a government body, plus volunteers, and plus आप लोगों का जो input होता है, जो आप लोग help करते हैं मिलकर. I think you can make it very, very big. So in this way, I think we can help each other.
Thank you so much. It's very, very encouraging to hear that, you know. और हम देख ही रहे हैं आप लोगों को, because I have been following for many years the education platform में दिल्ली में आप लोगों ने क्या किया है. I mean, I know, and Dolly is also involved in that, Atishi, and I have, visited places with them. And I am sure with your guidance and help, I would request all the CSR organizations here, for your work in Delhi, if we need, Dr. Arun Gupta will always be there. Let us spread our good work. Let us do more, and let us aim to do more and more. Let us make this coming year. अभी pandemic लग रहा है, पता नहीं डॉक्टर साहब आप क्या बताएंगे, लग रहा है कि खत्म हो रहा है. So 22-23 को let's make it a year where we double our achievements.
Yes, sir.
So let's see how that goes. So thank you very much, and we will, it's very, very kind of you to have come. Mr. Mohit Gandhi is also here. He is the convener of National CSR Network. On behalf of myself and all of us, we thank you for your words of encouragement and for making time. Thank you very much. God bless. Thank you so much. Okay. Bye-bye. Bye. Hanji, aap jaiye.
Thank you.
So, We are very grateful to Dr. Arun Gupta. He had promised, but I know that the results of Punjab are coming out and Aam Aadmi Party has made a big bid, and I think he was busy over there. So anyways, I'm grateful that he came because in my experience, he has helped. Whenever I have asked them, speak to somebody, they have helped. There are many issues, which keep happening. Kabhi a state problem hai, kabhi central government hai, but at least we know somebody in government is there to help us, which is a very nice thing. So since we've already sort of passed the time of the thing, I will now just call on Mr. Naveen Bhatia to give his closing remark. I will not summarize because I think I did that as we went along. I brought up major points which I hope the National CSR Committee people have noted down. What we plan to do is we want to make a white paper of the experiences of all the NGOs, and then Mohit is planning to take it to the Niti Aayog and see what we can do, how we can overcome these challenges, and we have some sort of a body which can monitor, impact, and be an advisory board. So before we conclude, I just want to call upon Naveen Bhatia. Naveen is a thought leader and implementation champion in the areas particularly of skill development and creation of innovative methods for digital learning content. He's worked tirelessly to create an army of competent trainers in not only the Indian subcontinent, also Africa, contributing to business individual development across industries and created path-breaking learning processes. So he has successfully created N-Class, an innovative and a simplest digital education content for classes of 1 to 10 in Maharashtra. And he is a very articulate speaker. Without saying any more, I would welcome him and request him to come and give us our closing remarks. Thank you, friends. Naveen ji, are you there?
Yeah, I'm there.
Acha ji, please come on. Okay.
Madam Moni Daljit Singh ji, thank you very much for a kind introduction. I think it was a great session. Let me do the first learning because we shared what good work we have done. Most of the time the world cribs, but this is the first time we all have shared what good are we doing for society. And I think such kind of meeting will help us to do much more. The second great learning, which Mrs. Mohini Daljit Singh said 3-4 times, and I want to say, she talked about a value called patience. In healthcare, things just don't change in a minute. I have a viral fever, so let me take all 10 tablets at a go and go in 1 hour's time. It doesn't happen. Everything takes its time. So social development, especially in healthcare sector, in malnutrition will take time. We have to be a value called patience and engagement. I think Sai Baba rightly says Shraddha and Saburi. That means you have to have faith and have patience. That is the second learning we all had. I think third, we did not spend much time, I think, but it came in bits and pieces. And I would like to say that the Psychiatric Association of India had made a research study and had, along with Lancet, given it to the central government last year, is on mental health. They say India has 45% people exactly. I mean, they are 63, 62 crore people who are in age bracket 15 to 45. They, out of which 44%, so we are talking about 63 crore, 44% are suffering from some kind of mental health issue. And it needs to be addressed in 2 formats. 1, education, 2, mentoring. So if you are aware, during the budget, government has set up a digital university called where technology partner is IIIT Bangalore and the content partner is NIMHANS. So I would request all our colleagues to be in touch with National CSR Network, especially Mohit Gandhi, because we are working on this area along with the Planning Commission to give mentoring support, education support to NIMHANS so that at least we are able to contribute to mental health. Last not the least, though it did not got shared, but as in our last remark, Mrs. Moni Jaljit Singh said that we have to do it. You must be aware that we have done 3 workshops over a period of time. And on 24th of March, Mohit Gandhi will be presenting to the Planning Commission a full-fledged presentation on the competency framework for CSR professional. Because we want to give this, see, there are too much regulation, but we also want to build competency in people competency. So he is going to make a presentation. Maybe we will come and share with everybody what is happening in that area. So thank you very much to everyone for sharing your good work, and let's spread it. That's what I would like to say. Thank you very much.
Thank you, Naveen ji, for sharing your valuable thoughts.